Hi everyone, welcome back to my channel. Nurse Katherine here. In today's video, I will be giving you 5 tips on how to study for pharmacology. Pharmacology has been deemed the hardest subject to study for in nursing school. I know I personally struggled in pharmacology in nursing school, and I know a few of you have too. So let's dig into this and let me help you understand pharmacology. Tip number 1 would be to study the root words in the actual medication names. Every medication comes with 2 words. There is the generic name, and then there is the brand name or trade name. NCLEX and most likely your nursing school only uses the generic name. Think of it like when you go to a grocery store. You have your generic foods, generic brand foods like the Kroger food, or you have that fancy name. That's the brand name or the trade name. That's kind of how medications work too. When studying medications by the root words, you will be able to see the similarities between classes of medications. Meaning some may have the same root words in the actual name, and that's what is important to know. That will help you understand what that drug does in the body. Tip number 2 would be make flashcards. This is one of the best ways to study pharmacology. You can make flashcards of just the root word, or you can make flashcards of the entire medication name. These flashcards can be super in-depth if that's what you like, or they can be very, very simple, and that's how mine were in nursing school. Simple and to the point, and that's how I learned best. There are multiple ways to make flashcards. You can use online resources to have digital flashcards, or you can write them on notepads. That's what I did because I found it helpful to be able to say the medication name out loud as I'm writing it and as I'm reading it, and that was just another way to help it sink into my brain a little bit more. Tip number 3 might be my most personal favorite way to study in nursing school in general, but pharmacology for sure. And that is to make mnemonics, make up silly songs, make up silly sayings that will help you remember these medications. I will share one of my silly little sayings with you all, and that is red man in the van. So vancomycin, you might have to pronounce it a little different, causes red man syndrome. It can cause that. So red man in the van, red man syndrome is the beginning, and then the van is the vancomycin. So that is a way I could remember that red man syndrome goes hand in hand with vancomycin. If you have more of that creative mindset, that out of the box thinker type of mindset, this might be an area where you will excel and an area where you will be able to understand your medications a little bit more. Number 4 is super important because this not only relates to you in nursing school, but relates to you when you actually are a nurse. And that is to read out loud the medications and what they are for your patients when you are on clinical. This was drilled into my head when I was in nursing school, but I have seen a lack of this when I see students out on the floor now. Being hands-on in clinical is one of the best ways to learn. When you are performing your med passes on clinical, make sure you always tell your patients the medication name and what they are for. Not only are you educating your patient, but you're helping yourself review those medications while on clinical. And this is something that you will do even when you are out of nursing school, explaining these medications to your patients. So why not start while on clinical? And my last tip for you all, tip number 5, would be not to study pharmacology in one long sitting. It can be extremely overwhelming. There's a lot of words that you might not know, and that's just too much. That probably will not help you sitting there for 2 hours studying medications alone. So break it up to about 10 to 15 minutes per day, taking at least 1 rest day per week, and study your pharmacology that way. If you have any other tips on what helped you study pharmacology, please comment below. If you have any questions, comment that below as well. But other than that, that is it for today's video. Thank you for tuning in. Make sure you do like this video, give it a big thumbs up, and make sure you are subscribed to my channel. Other than that, thank you for watching, and I will see you in the weekend's video. See ya.